Hi, I'm Dr. Peter Vila, and thanks for checking out this video. I want to talk about how to spot a fake. Or in other words, if you're looking at photos and it just seems a little bit too good to be true, maybe it is. And so when you look at plastic surgery and aesthetic medicine, you see a lot of photography of before and afters, right? And that's a good thing because as a consumer, you should look for those photos. You want to see results of things that they've done before. I see a lot of photos out there on social media of results that either just look too good to be true or have been manipulated in some way. And frankly, that's not okay. That's lying. And you as a consumer should be educated about how to identify those photos. I think the best patient is the educated patient. And what I really want to do is to give you those tools to be able to identify those photos. I'm not going to name people. I'm not going to show photos that have been manipulated because that's not what I'm trying to do here. But what I am trying to do is teach you to be a better consumer and a more educated consumer so that when you see these photos, you can judge for yourself. So what I'm going to teach you to do is train you in a very short amount of time to look at photos like a facial plastic surgeon looks at photos and does facial analysis. So some brief things about facial analysis. Whenever you look at photos, you always want to make sure that the head position is the same. So the Frankfurt horizontal plane is if you draw a straight line from the top of the ear canal out to the inferior orbital rim, this bone right here that you can feel, there should be a straight line going from the inferior orbital rim to the top of the ear canal. Okay? If the photo is like this or the photo is like this, sometimes you see people manipulate that for the neck, for example. So you'll have a photo like this and the next one's out like this. So look for that because the photos, the before and after, and sometimes it's impossible to get it exactly the same, but in general, that's manipulation and that's disingenuous. That's not a true result. The other thing is for eye bags, I see this a ton. So if the light is coming from above, it's going to really accentuate these landmarks right here. And I have a little bit of it, but it looks much worse when you're looking at it this way versus when you're looking at it like this. And so the lighting has a big difference. This is just the room lighting based on the light in the room coming directly above me down at me. And this is a horrible, unflattering way to take a photo. But what it does is it accentuates the eye bags and puts shadows on places where you don't want shadows. Versus now, when we're back to standard lighting, this is a standard photographer setup where you have two lights at 45 degrees, and I have a third light just for the background because it looks nice. But you see the difference between the overhead lighting versus this lighting. All of a sudden the eye bags look much better. What have I done? Nothing. Just changed the lighting. So if somebody tries to sell you on fillers or surgery and you see that there's an obvious difference in lighting, that's something you should be aware of. That should set off alarm bells in your head. Now, sometimes that does happen because you weren't able to get photos in the photo suite before the patient had surgery. That's happened to me before. So that can, that's one possibility. But you should still ask about it, right? I mean, there's nothing wrong with asking, just saying, hey, the lighting is different. Why is the lighting different in this photo? And if you see something like that, that's something to mention to the surgeon. Another thing is, I see this all the time, is they have photos without makeup and then photos with makeup, right? So everybody looks better with makeup on, right? That's why we wear makeup. But I would never tell a patient to not wear makeup so that I can take a picture and then wear makeup so that I can take a picture. But unfortunately, that's what often happens. When people come in for surgery, they may not be wearing makeup on the day that they come in for their consultation. And then when you see them post-operatively, they're all healed up, they look good, and they come in with a full face on. And so they look very different in the photos. And maybe the only thing you did was their rhinoplasty, but like their eyes look better and their skin looks better, and that's 100% makeup. So it's worth just noting those things. That will give you a better sense of photos. And the last thing to watch out for when looking at photos on social media, we talked about head position, we talked about lighting, focal length of the camera. And this is huge because you have selfies that are pretty much ubiquitous and have become so in the last 10 years or so. Now here's the difference between a selfie and the photo you're seeing right now. So right now, you've got a nice camera with a long focal length. So we're at about 80 millimeters right now, which is pretty much a standard videographer setup. If you switch to a selfie, the selfie is going to be like right here. So what's that? That difference is about 2 feet versus right now to the camera, there's about 6 feet in between me and the camera. So I'll show you exactly the difference that makes. This is the standard length, and this is what it looks like when you're taking a selfie. So this is something that can be manipulated to make the nose look smaller, for example. Everything looks smaller. When the focal length is so short and the camera is close to the subject, like with the selfie, things look bigger. The nose looks huge. The proportions are very, very different. When it's back closer to the standard length, which is where all models and actors and everybody gets their photographs taken, things look extremely different and they look more normal, and that's how our eyes normally see it. So you hear things like selfie dysmorphia, where people think their nose looks different than it actually does, and that's because they're looking at selfies where the camera is very, very close to you versus a standard photography length where, like most people, that's what you're seeing. So that's a huge thing. Those are the three things really to watch out for: lighting, head position, and the focal length of the camera. Hopefully that makes you a little bit more of an informed consumer when you're looking at photos on social media and everywhere else. So thanks for checking this out.